Occasionally I ask myself, does my dog really love me? Occasionally I also ask my dog, do you really love me, or are you just looking to get a new treat? The question I have for you today is, how much do you love your furry companions? Often when a new furry pet is added to the family, we as humans overlook the aspect of pet health care. One thing that our companions as dogs rely on us for is to protect them from things that they cannot comprehend. A prime example of this would be protecting our dogs against heartworm disease. According to Sabrina Kelper with Veterinary Team Brief, dogs should be started on preventatives no later than 8 weeks of age. Today, we're going to cover 3 main points about heartworm disease and why your pet should be on heartworm prevention every single month. Now, let me talk to you more in depth about heartworm disease and its effect on the life of a canine. Did you know that over 100,000 pets are affected by heartworm disease every year? That number is going to keep rising if we do not help our pets and protect them against heartworm disease. Heartworm disease is carried by different species of wildlife. An example of that would be coyotes or wolves. So once there's an infected wildlife in your area, the disease is then transmitted through mosquitoes. Once a mosquito is infected or has bitten an infected wildlife member, once that mosquito then travels to another pet, such as maybe one of our pet companions, that disease is transmitted from the carrier to the mosquito, then to our pets. There's a greater chance of infection spread when our pets are not on heartworm prevention. The American Heartworm Association states that when the infected mosquito bites another dog, cat, or susceptible wild animal, the infected larva is deposited onto their skin surface of the animal, and then the larva will then enter its new host through the bite of the mosquito. Once inside the new host, it takes approximately 6 months for the larva to mature into adult heartworms. Once mature, heartworms can live in dogs for 5 to 7 years. With dogs being a common pet and usually going outside often on walks and to use the bathroom, they are at great risk for infection, especially if they are not already on a heartworm preventative. There are hundreds of thousands of mosquitoes all over our nation, especially here in Florida. It's very important that we help protect our animals. Once a dog is infected with heartworm disease, some owners may think, well, they already have the disease, so that's it for them. But that is not a true statement. Heartworm disease, although can be life-threatening, it can be treated depending on the stage of the heartworm disease. But if left untreated, our pets can actually become a breeding ground for heartworms. The American Association of Heartworm also states that the dog is a normal host for heartworms, which means that heartworms can live inside our dog and mature into adults, mate, and produce offspring. If untreated, the numbers can increase, and dogs have been known to harbor several hundred worms in their bodies. There are different environmental factors that also come into play with the spread or percentage of infected animals across the nation. Some states with winters that can be really cold are at less risk of infection if the temperature is dropping low enough to kill a big percentage of the mosquito population in that area. The American Heartworm Society states that multiple variables, from climate variations to the presence of wildlife carriers, cause rates of infections that vary dramatically from year to year, even within communities, because infected mosquitoes can also get inside of our house, so both indoor and outdoor pets are at risk. While reading the American Heartworm Society's article on heartworm disease, I came across an interesting example of how heartworm disease is spread due to the climate change. That example would be that mosquitoes are blown great distances by the wind, and the relocating of infected animals or pets to previously uninfected areas also contribute to the spread of heart disease. This happened following Hurricane Katrina, when 250,000 pets, many of them infected with heartworms, were adopted and shipped throughout the country. Now that I've covered heartworm disease transmission, I will now discuss heartworm effect on health. As stated before, giving heartworm prevention monthly can protect our dogs against heartworm disease. Once a canine is infected with the disease, the damage can last a lifetime. According to the FDA, there are 4 classes of symptoms of heartworm disease based on severity. Class 1 is no symptoms to mild symptoms, such as occasional cough. Class 2, mild to moderate symptoms such as occasional cough, tiredness after moderate activity. Class 3 is more severe symptoms such as sickly appearance, the persistent cough, and shortness of breath after mild activity. Trouble breathing and signs of heart failure are common for class 2 and 3. Class 4, also called Cabell syndrome, is such a heavy worm burden that blood flowing back to the heart is physically blocked by the large mass of worms. Cabell syndrome is life-threatening, and a quick surgical removal of the worms is the only treatment option. Though surgery is risky, and with surgery, most dogs with Cabell syndrome die. Not all dogs with heartworm disease develop this syndrome. However, if left untreated, heartworm disease will progress and damage the heart, lungs, liver, kidneys, and eventually cause death. Now that we've discussed the health problems associated with heartworm disease, let's talk about how we can prevent heartworm disease from our pets. More dogs on heartworm prevention create a safer society for dogs across the nation. Heartworm preventative products come in many different forms, so that way they can be easily administered to your pet. Those forms include tablets, chewable tablets, and also topical treatment, which would be applied to the dog's skin. Each product typically lasts for 1 month, so that means that dogs should receive heartworm prevention every single month. There was a study done by Lisa Young to test the effectiveness of heartworm prevention. Her trial stated that a total of 325 dogs were screened and recruited for the study from 8 veterinary clinics throughout the United States. A total of 317 dogs were enrolled, treated, and subsequently used in the analysis of the safety or effectiveness for IP and CP groups during the 11-month study period. In this period, reported field study conducted in heartworm epidemic areas of the USA, none of the combination IP treated dogs tested positive for adult heartworm infection when dosed monthly for 11 consecutive months, thus proving 100% prevention of heartworm disease. Now that I've talked about the bite of infected mosquitoes with climate transmitted, now that I've talked about how heartworm disease is transmitted and how we can prevent it, I will do a review of the information just stated. The long-term effects of heartworm disease can affect a dog's heart, lungs, kidneys, and liver. If left untreated, it can eventually cause death. Heartworm prevention is proven to be effective in preventing heartworm disease. With 1 heartworm prevention dose a month, you can keep our dogs safe from this life-threatening disease known as heartworm disease.